Good morning and welcome to our weekly briefing. So let's start off this morning with an update to our numbers. Since last week, 1,484 more Philadelphians have been diagnosed with COVID. As of yesterday, we're seeing an average of 256 new cases per day, which is once again slightly lower than what I reported last week. 3% of test results we're receiving are positive, which is unchanged from last week. And I'm extremely pleased to report that as of yesterday, more than 85% of adults in Philadelphia have gotten at least one dose of COVID vaccine, and more than 70% of adults are fully vaccinated. You can see these figures for yourself on our newly updated COVID vaccine dashboard. Go to phila.gov/COVID, click on data, and then on vaccine. You'll see that we've separated out information on people who have at least one dose and people who are fully vaccinated. So you can see the demographic breakdown for both of those groups. One of the new additions is that we're now reporting the percentage of people 12 and over who have received at least one dose or are fully vaccinated, in addition to those numbers for people age 18 and older. More than 79% of eligible Philadelphians have received at least one dose, and nearly 65% of eligible Philadelphians are fully vaccinated. So that's for that 12 and up group. We're also now publishing the number of third doses administered on that page, which has gone up by more than half in just 1 week. Now more than 16,500 Philadelphians have received a third dose of COVID vaccine. So now that we're talking about vaccines and how important they are, I wanted to talk a bit about deadlines. First, if you're looking to bring thanks and holiday spirit to your Thanksgiving table and not COVID, you still have time to get your vaccine beforehand and be fully vaccinated. So in order to be fully vaccinated by Thanksgiving, you would need to receive your first dose of Moderna vaccine by October 13th, which is next Wednesday. That way you can get your second dose by November 10th, and then you'll be thankfully fully vaccinated. Thank you, Jim Guerra, for that. If you would rather have Pfizer, you have until October 20th, the following Wednesday. You'd get your second dose November 10th. Again, you'd be fully vaccinated by Thanksgiving. And of course, for Johnson & Johnson, you would just need to get your vaccine by November 10th in order to be fully protected by Thanksgiving. But really, why wait? If you want a single dose of J&J, or you want Pfizer or Moderna, there are clinics and pharmacies all across the city that would be delighted to see you today. Then you don't have to worry about those holiday deadlines. There is another deadline that we need to talk about today, though, which is the October 15th deadline for university staff, students, and faculty, and for healthcare workers to be fully vaccinated. We've seen from other places that have implemented vaccine mandates that they work, that workers do step up and get their vaccines despite lots of anxiety before the deadlines. I want to thank the many healthcare institutions, colleges, and universities that have been working hard to implement the mandates. I have also heard from many groups that are concerned about being able to meet that deadline, particularly from our behavioral and home healthcare providers whose staff have lower vaccination rates. My goal is to get everyone vaccinated and not leave our healthcare and higher education systems shorthanded, especially when we know that folks are making an effort to get vaccinated. At the same time, we know that these are settings where people are at risk from COVID and where an unvaccinated staff member could easily spread infection. So we're making some temporary accommodations to allow a little bit more time for these groups to get vaccinated. For healthcare staff in hospitals and long-term care facilities, and for everyone in higher education, they will need to receive at least one dose of a COVID vaccine by October 15th, rather than being required to be fully vaccinated by that date. That is next Friday. They would have to get their second dose if they get Pfizer or Moderna by November 15th. Hospital, long-term care facility, and university staff, students, and faculty who don't have approved exemptions and who don't have that first dose by October 15th, next Friday, or if required, their second dose by November 15th, would be out of compliance and could not work or study in those settings. All other healthcare workers, except for those in hospitals or long-term care facilities, will have one additional week beyond that accommodation until October 22nd to receive at least one dose of a COVID vaccine. They would have to get their second dose by November 22nd and would need to be tested twice weekly until they're fully vaccinated. To reiterate, staff, students, and faculty at universities and healthcare workers at hospitals and long-term care facilities need at least one dose by October 15th. All other healthcare workers need to receive at least one dose by October 22nd. Second shots for those who choose Pfizer or Moderna need to be completed 1 month after the deadlines for first shots. My hope is that this additional time will help to get all of these workers over the last hurdles to accepting vaccination. As always, if a business or an institution wants to be more strict, they can be. I know that I just threw out a lot of dates and deadlines and timings, and it can be confusing. So to help clarify, we're posting a blog on our website this morning to spell it all out. But if you want to make it super easy to remember, think of it this way. If you're not vaccinated, get vaccinated today, and then you don't have to worry about any of these deadlines. To wrap up, if you'd like more information about the pandemic and the city's response, you can visit our website at phila.gov/COVID. If you have questions, please call our COVID call center at 215-685-5488. Now I'll turn it over to Zelly to present my remarks in Spanish. Thank you.
Buenos días y bienvenidos a nuestra sesión informativa semanal. Comenzamos esta mañana con una actualización de nuestros números. Primero, desde la semana pasada, 1,484 habitantes más de Filadelfia han sido diagnosticados con COVID. Hasta ayer, estamos viendo un promedio de 256 nuevos casos por día, que una vez más es inferior a lo que informé la semana pasada. El 3% de los resultados de las pruebas que estamos recibiendo son positivos, que no han cambiado con respecto a la semana pasada. Me complace informar que hasta ayer más del 85% de los adultos en Filadelfia han recibido al menos una dosis de la vacuna COVID y más del 70% de los adultos están completamente vacunados. Puede ver estas cifras por sí mismo en nuestro panel de control de vacunas COVID recientemente actualizado. Vaya a phila.gov/COVID y haga clic en datos, luego en vacuna. Verá que hemos superado la información sobre las personas que tienen al menos unas dosis y las personas que están completamente vacunadas, por lo que puede ver el desglose demográfico de ambos grupos. Una de las nuevas adiciones es que ahora estamos informando el porcentaje de personas mayores de 12 años que han recibido al menos una dosis o están completamente vacunadas. Además de eso, números para las personas mayores de 18 años. Más del 79% de los filadelfianos elegibles han recibido al menos una dosis y casi el 65% de los filadelfianos elegibles están completamente vacunados. También estamos publicando el número de terceras dosis administradas en esta página, que ha aumentado en más de la mitad en solo una semana. Ahora más de 16,500 habitantes de Filadelfia han recibido una tercera dosis de la vacuna COVID. Ahora que estamos hablando de las vacunas y lo importante que son, quería hablar un poco sobre los plazos. Si está buscando llevar el agradecimiento y el espíritu navideño a su mesa de acción de gracias y no COVID, todavía tiene tiempo para vacunarse. Para estar completamente vacunado antes del Día de Acción de Gracias, tendría que recibir su primera dosis de Moderna antes del 13 de octubre, es decir, el próximo miércoles. De esa manera, puede recibir su segunda dosis antes del 10 de noviembre y luego, afortunadamente, estará completamente vacunado. Si prefieres Pfizer, tienes hasta el 20 de octubre, que es el miércoles siguiente. Usted recibirá su vacuna dosis el 10 de noviembre y nuevamente se vacunaría completamente antes del 10 de Acción de Gracias. Para Johnson Johnson, necesitaría su vacuna antes del 10 de noviembre para estar completamente protegido para el Día de Acción de Gracias, pero ¿por qué esperar? Si desea una sola dosis de Johnson Johnson, hay clínicas y farmacias en toda la ciudad que estarían encantadas de verlo hoy. Y luego no tendrá que preocuparse por los plazos de vacunaciones. Sin embargo, hay otra fecha de límite de la que debemos de hablar. La fecha de límite es el 15 de octubre para el personal universitario, los estudiantes y la facultad y para los trabajadores de salud que estén completamente vacunados. Hemos visto en otros lugares que han implementado mandatos de vacunas que trabajan y que los trabajadores dan un paso adelante y reciben sus vacunas a pesar de mucha ansiedad antes de los plazos. Quiero agradecer a las muchas instituciones de salud, colegios y universidades que han estado trabajando arduamente para implementar los mandatos. También he escuchado de muchos grupos que están preocupados por poder implementar con la fecha de límite, particularmente de nuestros proveedores de atención médica, conductual y domiciliaria, cuyo personal tiene tasas de vacunación más bajas. Mi objetivo es vacunar a todos y no dejar a nuestros sistemas de salud y educación superior cortos, especialmente cuando sabemos que las personas están haciendo un esfuerzo para vacunarse. Al mismo tiempo, sabemos que estos son otoños donde las personas están en riesgo de COVID y donde un miembro del personal no vacunado podría propagar fácilmente la infección. Así que estamos haciendo algunas adaptaciones temporales para permitir un poco más de tiempo para que estos grupos se vacunen. Para el personal de atención médica en hospitales y centros de atención a largo plazo y todos en la educación superior deberán recibir al menos una dosis de una vacuna COVID antes del 15 de octubre, en lugar de tener que estar completamente vacunados para esa fecha. Eso es el próximo viernes. Tendrían que recibir su segunda dosis si reciben Pfizer o Dorma antes del 15 de noviembre. El hospital, el centro de atención a largo plazo y el personal universitario, los estudiantes y los profesores que no tienen accesiones probadas y que no tienen esa primera dosis para el 15 de octubre o si es necesario su segunda dosis para el 15 de noviembre, estaría fuera de cumplimiento y no podría trabajar o estar en estos turnos. Todos los demás trabajadores de salud, excepto los que están en hospitales o centros de atención a largo plazo, tendrán una semana adicional más allá de ese alojamiento hasta el 22 de octubre para recibir al menos una dosis de una vacuna COVID. Tendrían que recibir su segunda dosis antes del 22 de noviembre y tendrían que hacerse la prueba 2 veces por semana hasta que estén completamente vacunados. Para reiterar, el personal, los estudiantes y los profesores de las universidades y los trabajadores de la salud en hospitales y centros de atención a largo plazo necesitan menos una dosis antes del 15 de octubre. Todos los demás trabajadores de la salud deben recibir al menos una dosis antes del 22 de octubre. Las segundas inyecciones para aquellos que eligen Pfizer o Moderna deben completarse en un mes después de las fechas de límite de su primera inyección. Mi esperanza es que este tiempo adicionar ayude a que todos estos trabajadores que superen los últimos obstáculos para aceptar la vacunación. Sé que acabo de lanzar muchas fechas, plazos y tiempos y puede ser confuso. Así que para ayudar a aclarar estos, estamos publicando un blog en nuestro sitio de web esta mañana para explicarlo. Pero si quieres que sea súper fácil de recordar, piénsalo de esta manera. Si no estás vacunado, vacúnate hoy y luego no tendrás que preocuparte por los plazos. Para concluir, si desea obtener más información sobre la pandemia y las respuestas de la salud, puede visitar a nuestro sitio web en phila.gov/COVID. Si tiene alguna pregunta, llame a nuestro centro de llamadas COVID al 215-685-5488. Thank you.
Thank you very much, Zelly. We'll now move to Q&A. Again, reporters are asked to limit their questions to 2 or fewer and ask that you stick with the topic at hand. If there are any reporters who do not get the chance to ask a question, please follow up with us by email and we will get you that answer. First up, we'll go to Laura McChrystal from the Inquirer. Go ahead, Laura.
Hi, Dr. Bedigal, I'm wondering, in extending these deadlines for the mandate, are you hopeful that it will actually make a difference if people haven't already gotten vaccinated, you know, given that they had a lot of warning leading up to this deadline?
Yes, and what we're being told by healthcare institutions particularly, and by the colleges and universities, is that a little bit more time would be very helpful to them in getting people vaccinated. What we've seen from other places is that mandates are actually extremely effective in getting people to get vaccinated. So we do believe this is going to have an effect and that the extra time could be helpful.
Okay, do you anticipate any chance that you would be asked by these employers to extend the deadline again?
I certainly anticipate that we might be asked to. We are not planning to extend the deadline again.
Okay, and lastly, could you maybe clarify, you said you had heard from home healthcare worker employers and also behavioral health especially. And I do see that they get a longer extension, but can you clarify, it wasn't just them saying they needed an extension, it was everyone essentially?
Well, we've heard in general that a little bit more time might be helpful, but I think the greatest concern has been expressed by the home health care agencies and behavioral health. And I will say, there's certainly concerns from the long-term care providers as well. Not necessarily as vociferously expressed, but certainly I think real concerns. But because the long-term care facilities are such a dangerous and vulnerable setting, we didn't want to extend further there. So that's why they don't have the additional week.
Okay, so they have no extension. Okay.
No, they have the same extension that hospitals have. So 1 dose by October 15th, rather than a requirement to be fully vaccinated by October 15th. So that includes waiving both the 2 weeks post last vaccination and waiving the requirement that the second dose be before that October 15th deadline. So depending on which vaccine, it does give them a number of extra weeks.
Okay, thank you.
Sure.
Thank you very much, Laura. Next up, we will go to Alicia Reed from CBS 3. Go ahead, Alicia.
Thank you so much for taking my question. We're following CBS reporting a high percentage of law enforcement officers declining to be vaccinated. Is there an update available on how many Philadelphia officers are vaccinated ahead of the city employee vaccine mandate later this month?
So I think that may be a slight misunderstanding. So there is already a city worker requirement for vaccines or double masking, and that would include police. The mandate that we're talking about is a mandate for healthcare workers and for colleges and universities, and that starts October 15th. So for police officers, I don't have updated data right now, but their requirement is either to be vaccinated or to double mask.
Got it. Thank you so much. And my last question is about STDs. We've seen reports of sharp increases during the pandemic. Has this been an issue of concern here in Philly? And what populations have you seen the highest numbers?
So I'm happy to get you that data. I don't have it right in front of me right now, but happy to share data on STDs.
Thank you, Alicia. I will reach out to you with some information about that after we're done. Next up, we're going to go to Becca Hendrickson from Channel 6. Go ahead, Becca. You should be able to unmute. There you go.
Hi, thanks for taking my question. With the city worker deadline, as of last week, I believe only 32% of city workers had uploaded their vaccine cards, or like you said, have double mask. Do you have an update on how many city employees have uploaded their cards now and are vaccinated?
I don't think that number has gone up significantly right now. This is people who have put their card into our system. It's not, obviously, there are many more who are probably vaccinated. But because the requirement can be met by double masking, anybody who hasn't uploaded their card right now does need to double mask.
Why do you think people aren't uploading their cards then? I think the number's higher.
Yeah, no, I think that the system is a little bit cumbersome. And I think, my understanding from many city workers is that they prefer to continue to mask. So I don't know that their incentive to give us their information is that high, since they want to stay masked, at least for a lot of us.
Also, how is the city preparing for more boosters with, more of these vaccines getting approved soon and possibly opening up to the general public?
So what we've seen so far has not been overwhelming demand at all. I think roughly 5,000 boosters that were given within the past week is about 25% or round about that range of the number we've been giving week by week. We have much more capacity than that in the city. We have more than 350 vaccine providers across the city. So even if Moderna and J&J were both approved for boosters, there's still a lot of unused vaccine capacity in the city. And to anybody who is thinking of getting that dose before next Friday, go out and do it. There are people waiting to give you those shots. But that massive demand that we were a little bit concerned and trying to make sure we were ready for really hasn't happened so far. And I think we're starting to put out reminders to people who are 6 months post Pfizer dose number 2, and that may up demand a little bit, but we're not getting a torrential response.
Thank you.
Thank you very much, Becca. Next up, we'll go to Carolina Rodriguez from Univision. Go ahead, Carolina.
Hello, good morning, everyone. Thank you for taking my question. Dr. Bedigal, I was wondering if you could give us a little bit of insight regarding coronavirus vaccine and flu shots, both at the same time. Is that recommended? Do you encourage our people to do that during the season?
Yes, absolutely. And thank you for that question. So we are anticipating that this may be a tough flu season. At least that's what we're hearing so far. It is now considered safe. The CDC has approved for people to get their flu shot and their COVID vaccine at the same time if they want. You also don't have to. If you'd like to wait a couple weeks in between, that's totally fine. But please don't avoid getting your flu shot because you want to get your COVID shot. Whether you choose to get them on the same day, again, totally fine. That's safe. Or you want to space them out, but you do want to make sure to get that flu vaccine. Among other things, our hospitals are seeing a huge influx of people with other respiratory viruses and other kinds of illnesses. So they're actually quite full right now, even though they're not quite full of people, they're not overloaded with people with COVID. And so, we are concerned that a bad flu season could further overload those hospitals, the emergency departments in the hospitals themselves. And besides, nobody likes having shaking chills in a miserable week. Get the flu shot.
I have a follow-up question regarding remdesivir. It's been a while since I heard about that in the city and in Pennsylvania as a general. Can you give a little insight about remdesivir in hospitals and in Philly Health Department?
So it's been used for people who are seriously ill in hospitals. It's not something that we're using for outpatients. So for most people, it doesn't come up because it would be a decision made by a physician working with them if they're an inpatient at a hospital. But my understanding is that supplies are currently adequate. We can get you more information on remdesivir if you would like.
Thank you very much. Have a great day.
All right. Thank you very much, Carolina. Seeing no other hands raised, we will end today's briefing. Thank you very much for joining us today, and we will announce next week's briefing on Tuesday of next week. Thank you very much all, and stay safe.